So there were some 950 new COVID cases reported yesterday. All of these were locally acquired. This brings us to now active cases at 9,890 in the state of Victoria. I'm very sad to have to report that 7 people lost their lives to COVID-19 over that reporting period. 2 were women in their 80s, a man in his 80s, a woman in her 70s and a woman in her 50s. All of these 5 were from the Hume region, and a woman in her 80s and a woman in her 90s, both from the Whittlesea communities. Can I use this as an opportunity to pass on all Victorians' deepest condolences to the families, the friends and the communities of those people whose lives have been lost. There were 371 people in hospital with COVID-19. 81 of those were in intensive care and 55 of those 81 were on a ventilator. There were some 61,322 tests for COVID-19 undertaken yesterday, a good solid number. And can I use this as an opportunity just to reiterate that with the slightest of symptoms, the most important and urgent thing you need to do is to get yourself tested. There are also some 34,028 vaccines delivered through state-run clinics, and with the increasing emphasis on distribution through GPs and pharmacies and others under the Commonwealth's vaccine program, I did note that there was some 90,000 plus vaccines distributed yesterday according to the Australian Immunisation Register. Yesterday we did speak about the situation in Latrobe in Gippsland, the Latrobe local government area, and over the course of yesterday the situation in a public health risk sense deteriorated quite rapidly as more work was undertaken by the local public health units. And in that regard, a difficult decision was made yesterday afternoon to call a lockdown in the Latrobe City Council areas. I apologise for the short notice, but the strong advice from the public health team was, given the rapidly deteriorating situation, these strong measures to keep that community as safe as possible were required. And I understand the COVID commander has been down in that community talking to community and the media about some of the rationale behind that, but I'm sure we're happy to explain it further. We really had little or no choice through the public health advice but to act, and to act quickly. We expect that the testing demand is high, and the reports that we've had this morning is that that is precisely the case. And we ask those with symptoms and those who have been contacted as close contacts of cases, of which there are a growing number, should be the priority cases to come forward and get tested. They are the most urgent ones, and we would ask the rest of the community to triage that approach in that appropriate manner. So please, if you've got any symptoms in the Latrobe community, or indeed you're been advised that you're a close contact, please come forward and get tested. There are now 2 new pop-ups in Traralgon, in addition to the existing sites in Traralgon, Morwell and Moe, and both hours of operation and supports have been increased. Many of the testing sites are also running extended hours with increased capacity of staffing and support. Please check the coronavirus.vic.gov.au website for both opening hours and locations. We're also ramping up the vaccination efforts in Latrobe in response to that outbreak down in that community. The Traralgon Racecourse vaccination site and 7 other community sites in the area will all be extending their hours and opening, including on the weekend for Saturday. We're also delivering 5,000 further Moderna vaccines, not just in partnership with the community pharmacies, but into the area to bolster the state-run clinics highly effective and increasingly sought after mRNA vaccine in that community. Staff in the Gippsland Local Public Health Unit and at La Trobe Health are all well and truly trained and prepared and eager to get those vaccines into as many arms of the people of La Trobe as we possibly can.